The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
Welcome back to AM Northwest. You know, carrying excess weight is much more than a cosmetic issue. It not only impacts your quality of life, it puts you at risk for a host of health problems. Here with some important insight into the obesity health crisis, we welcome from Providence Center for Weight Management, Dr. Davila Bradley. Good to have you with us, doctor.
Thank you so much.
Let's talk about obesity, what it means. How do you define obesity?
We use a metric which is called BMI to define obesity. BMI 30 or higher is defined as obesity, and there's different classes depending on how higher the BMI goes. And BMI might be not the perfect metric because it can be imperfect in the sense of it's a relationship between weight and height. But if you think of someone like Arnold Schwarzenegger, early in his life, and nowadays, his BMI probably hasn't changed that much, but his body is definitely different.
Yeah, for sure. Obesity is increasing, isn't it? Or is it?
I mean, it's a disease. I think that's the bottom line of it.
Okay.
That it's a disease that has multiple factors, genetics, environmental, you name it, and it's just increasing based on those genetic factors and environmental factors with the foods that we have around us.
Well, what do you say about the foods? Is it more processed foods? Is that what you're saying?
I think processed foods is part of the problem, eating behaviors.
We don't walk as much. We're not as active as previous generations.
That's definitely part of it. And we also have much more access to foods that we didn't have before.
Oh, right. How does excess weight, being obese, affect a person? What kind of toll can it take on them?
So as a disease is going to affect every single one of our organs, right? Our hearts, lungs, kidneys, liver, bones, joints. Even our brain is affected by obesity.
And does it lead to diseases? Like, can it lead to cancers?
Absolutely. If you look at the top 10 diseases that kill people in the United States or in the world, most of them will be associated with obesity, heart disease, diabetes, and cancers as well.
And then can it affect your joints?
Absolutely.
Like your knees, your hips?
Yeah, it's imagine carrying 2 heavy luggages every day.
Right.
What's going to do at the end of the day to your knees is kind of like that, right? It's not just the excess weight, but it's also the metabolic effects on all of our organs.
So what help is available? I mean, we hear about all the drugs. We see all the TV ads.
I think the approach that we need to take into obesity is first understand it's a disease. And as a disease, it's a chronic disease that needs chronic management.
Okay.
Not different than cancer, where you have a multidisciplinary team. Obesity, that's what we need to tackle it with behavioral health specialists, dietitians, people who really are passionate about obesity. And surgery has been one of the things that have impulsed the treatments of obesity in the last few decades.
Just tell me about the surgery. So
surgery by itself is not just a thing. I see surgery as one tool of many tools that we have.
Yeah.
It has proven to be the most effective tool that we have, but it's also scary to think like, someone needs surgery because of the degree of the disease. And definitely we have walked away from that. Surgery has become so safe, but it's also just one more tool. When I talk to patients about it, I always tell them, like, it requires a lot of hard work and a lot of investment on your own body and your person. So you're going to work very hard with a team who's going to help you. A lot of the work you have to do yourself, but you're not solo, you're not alone. You're going to do it with a team. I'm going to do this little bit. And it's just one more tool that you can use for it.
Well, and you use the medication that we hear about now, right?
Absolutely,
as another tool, because you can't just the medication and that's it.
That's exactly right.
And
that's what we see out there, is that people are just using medication and expect that the medication is going to do it.
Right.
Same way people just use surgery and they feel like surgery is just going to do it. One of my favorite stories I told patients is a patient I saw many years ago who, after weight loss surgery, lost 200 pounds. And then she regained 200 pounds.
Yeah.
Then she did a lot of diet and exercise and lost 200 pounds. And she said the surgery didn't work. I had to do a lot of diet and exercise. And I said, the surgery absolutely worked. It started working when you started using it. And that's the mentality around weight loss surgery, is just not the one tool. You have to use all the tools that you have available.
Absolutely. All good information. We want to tell everyone, if you would like to find out more about weight management resources at Providence Health and Services, all you have to do is go to our website at k2.com/Family Matters. Doctor, thank you so much.
Thank you so much.
All right.